Today we're going to demonstrate how we start an IV on a patient or perform the venipuncture. First off, when I come in the room, I want to explain to the patient what I'm going to do, provide patient privacy, ask the patient about any allergies to anything. Then I want to wash my hands, and I want to make sure that I set up my supplies. First off, just a good rule of thumb to do is to place a chucks or a towel or something under your patient's arm, just to help protect your linens and the patient gown and that kind of thing. So I would do that. Then you'll want to kind of inspect to see what a good location would be, and we talked about that in lecture. You could have the patient kind of dangle their arm over the side of the bed. That'll help promote blood flow to the vein. So if I've determined kind of where I want to do that, I'm going to assemble all of my supplies. So you'll have an IV kit. Comes like this, it's already put together. There will be several things in there. You'll have a tourniquet. Get it undone here. You're going to have a small roll of tape. You're going to have your prepping sponge. And then there should be a 2x2. You're going to have this tegaderm or covering to put over it. And then there'll probably be a little butterfly adhesive strip in there to help with securing the IV. So I've got that. Then you'll have an extension set. This is going to go on the end of the catheter after you've put it in. But you'll want to go ahead beforehand and have this set up, because once you get that IV started, you're going to be needing this. So you kind of leave it in its package. Then you've got 10 cc's of normal saline for a flush. You go ahead and open that. Get out of the way. Then you'll want to take your extension set, right end here. Keeping it sterile, you don't want to touch that because you just got it out of the clean, sterile packaging, so it should still be sterile. Attach this to it. And then you'll want to flush, be sure that you flush that tubing. And so you can let a little bit drip there. Sometimes I'll go ahead and maybe loosen this a little bit, just because it's kind of hard to get loosened when you are trying to hold on to a million other things. So, got that. Then I'll want to apply the tourniquet. And the way I do it, you kind of pull tightly on this side and take this other side and go like where your finger is at under there. Stick the end under there. So that way your extra loose ends are up this way away from your area where you're going to be sticking. And then that way you can quickly just pull with one hand here to release that tourniquet when you're through. So once you have your tourniquet applied and you can see your vein, you can feel for the vein, and it should feel kind of spongy or bouncy. If it's a good vein, you should be able to see it and feel it, hopefully. I wouldn't necessarily try to go for one that you can't feel it or can't see at this point, but you should be able to feel and see it. So then you would squeeze this, and that activates that chloroprep, and then you just want to clean it for about 30 seconds and go around. I usually kind of just start and go around and clean it, and then let that dry. Then you need to be sure, once you've cleaned that vein, you don't go back up there and start feeling around on it again, because you will contaminate it again. So it's already clean. You need to let that just air dry. I'll probably pick the vein that's going to be hard to get a hold of there. So then you go ahead and open up your catheter. Again, you want to make sure, can you zoom in and see that the bevel is up? There's like a little hole there in the top of that needle, That's the bevel. You want it on the top surface when you go to stick. You don't want it pointing down. You want it pointing up. So then I get a hold of my patient here. Now you want to go in, let's see if I can find where I'm at here. Kind of at about a 45. There we go. So once you kind of get a little bit of a blood flashback, you want to kind of lower your needle somewhat. Go in just a little bit more. Then you want to just hold the needle steady. Let me get a hold of that. And then advance the catheter. Just the catheter part. See, the needle stayed there. Then at this point, undo your tourniquet. Then you'll want to apply some pressure here to that vein up above where you have stuck it in. That'll kind of hopefully keep it from the blood from flying back out at you. You want to get a hold of your extension set here, have it ready to attach. And you take out your needle, attach that. You can hold on to the hub now so that you can screw this on here really good. A lot of times that's where we'll have leaks and problems, is where that's not screwed on tightly, and then you'll get, like I said, some leaking around that. Now you can hold that on. We're not actually going to inject this here, but in a patient you would try the flush to make sure it flushes easily and that you don't have any bubble come up here, any swelling or any extreme pain from the patient or anything like that. It should flow easily. It should flush easily. You shouldn't feel any resistance or anything like that. So you leave that there. Take your little part here. His arm wants to fly around. This little small part goes underneath. And then the top part goes right across like this. So I do that to kind of get me secure so I can work a little bit better. Then you go to your tegaderm. I'm trying to hold his arm up. And apply it right here. Now, I don't go down here over this because you may have to unattach that for some reason, and then once you put this over it, it's very difficult to do. So I place it right here. Take that off. Now, then you get another piece of tape, which I probably should have already pulled before we did this. And then you'd want to take this around. Actually, clamp that. You can take that around and tape it in place. Once that is clamped, then you can undo this here. And you've just got your saline lock. Now there is a label that comes on this op site, so then you would put the date and time and your initials and the size of the catheter you use on there. You take it off, and then of course you don't lay it right over the site. You want to be able to see that site all the time, so you would put it like along the edge here. And that should be it.